and we're going to be sharing with you some of the information about the development of our Wellbeing Pods initiative in Leeds Libraries. This is a partnership between health and libraries. So my name's Andrea Ellison, I'm Chief Librarian with Leeds Libraries, and I'm going to be both chairing and contributing to today's session. So during the webinar, you'll be hearing about both the background to the initiative as well as feedback from some of our practitioners and their service users who've had experience of using the pods to date. And we'll also be having a look at some early thoughts we've got around evaluation. I think I wanted to really emphasise, though, that we're still very much in the early stages of implementation of the Wellbeing Pods. They've been operational now for just over 6 months. And so I see this still very much as an evolving project. So just to bear that in mind as you listen to our speakers today as well. So I'd like now to welcome our first speaker for today's session, Emily Carr, Associate Director of Pathway Integration for Children, Families and Healthy Populations, who's going to be talking about health innovation and community-based healthcare in Leeds. So welcome, Emily.
Thanks, Andrea. Thanks for that lovely introduction. So hi, everyone. Welcome to this fantastic webinar about one of the really homegrown innovations that is occurring in the city at the moment. I wanted to start my few words with you today by talking a little bit, next slide, please, about who we are in Leeds. So Leeds, if you're not familiar with us, is a city that should in the next few years be home to 1 million people. We're the most populous metropolitan area after London and Birmingham. We're home to 4 universities and the largest teaching hospital trust in Europe. We're a really diverse city. There's over 170 languages spoken here, and more than 1 in 4 people identify as belonging to an ethnic group that isn't white British. We were also previously home to a Premier League football team. Next slide, please. So in Leeds, we experience some universal and continued challenges despite our collective efforts. I won't read the points on these slides one after the other, but I'd like to take you on a journey through Leeds with me. So Leeds is a city of the Yorkshire Dales to the north and some of the industrial landscape which drove the Industrial Revolution in this country in the south. And if you walk from the leafy green suburbs in the north of Leeds towards the south of Leeds, life expectancy drops by a year with every mile you walk from north to south. And for expectant parents, the risk of their baby being stillborn increases tenfold on that journey. Next slide, please. These challenges really are stark. I share them not to shock you, but to help an understanding of the kind of challenges that we no doubt share and that have brought so many people to this call today to find out about areas of innovation which we all have an opportunity to take forwards. The experience of health inequalities is present in all our health and care partnerships to a degree. And I believe, and this team believes, that some of the ways of working to reduce those can also be universal. I've shared on this slide some of the patterns in inequality that you see across the city, and working in this local way enables us to think about driving changes which have far-reaching impacts across the experience of deprivation, across mortality rates, across vaccine take-up, across the experience of lots of different health services by working at that local level. Next slide, please. So I wanted to describe to you some of the partnership development areas in Leeds. We have an ambition to become a marmot city. Some of you may already belong to those and be part of the journey that's happening to tackle health inequalities across the city. And I'm really proud of some of the partnership decision making that we showed around the recent Core 20+5 investment into health to tackle health inequalities at a community level. And these words all sound very fancy, but if you move on to the next slide, really what I'm talking about is the way that people work with each other. To enable change and tackle health inequalities, we need bold but very local leadership, understanding those issues that people face in their day-to-day lives that give rise to their experience of health inequalities. I believe we need collective bravery, and we need solutions that have been created in and with communities. And many of the changes that we make will be on a small scale, And the system that we work in needs to enable rather than prevent us from making those small and nimble changes and improvements that can make a big difference to people's lives. And today you'll hear about one of those through the Wellbeing Hubs and Libraries, which is an innovation truly of very low cost and potentially significant far reach. I'd like to close my opening remarks with the following quote on the next slide. In the infinite wisdom of A.A. Milne. Now I try to read this without crying. Winnie the Pooh does always bring a tear. And Pooh says, poetry and hums aren't things which you get. They are things which get you. And all you can do is to go where they can find you.
Thank you very much, Emily. That's really provided a really useful context by way of an introduction to this session and to the work that we're actually trying to do here in Leeds. I'm going to move on now to give you a little bit more about the background about the development of the Wellbeing Pods. And for this session, I'm going to be joined by Rachel Van Riel, who's the director of Opening the Book, who will be talking about some of the design principles for the pods. But to begin with, a few words about the context for this initiative from the Library Services perspective. So next slide, please, Lisa. Health and wellbeing is one of the 3 pillars which underpins our Best City ambition in Leeds. And as library colleagues on the call will know, health and wellbeing is very much one of the 4 National Public Library universal offers. So given this, support for health and wellbeing sits very much at the heart of our library service priorities in Leeds. So our programme for support for health and wellbeing, next slide, Lisa. Across our library network in Leeds, we have 34 community libraries. Many of these have been refurbished over the past 5 to 6 years to provide high quality community spaces, free, accessible and welcoming spaces in the heart of our local communities, spaces where people can come together to meet and mingle. I always say this actually, but I believe it very much that our libraries are the natural bumping spaces in communities. They're places for residents to come together to share the resources that we have in our libraries and also share the spaces. And in these spaces, as well as a programme of specific events and activities, we also provide regular ongoing activities such as community Scrabble and jigsaws, activities that really help maybe to encourage chance conversations, so supporting that loneliness and isolation agenda. And we also, across our library service, provide key underpinning principle of our library service is the provision of access to high quality health information, but health information specifically. One of the ways we do this is through our Reading Well collections. These are books to help residents better understand and manage their own health and well-being. The books on the book lists have been chosen by health experts and people living with those conditions. And the Reading Well collection includes books on mental health, long-term conditions, dementia, as well as 2 separate book lists, one to support children and one to support younger people on, again, they're managing their own mental health and well-being. We have programmes of activity, whether it's a story and rhyme time for babies and preschool children, or a small social group for older residents in our libraries, or a programme such as Creative Mind or Sound Mind, which promotes and encourages wellbeing through creativity. And these events really do provide those opportunities for people to come together, to learn, and to be with each other and to stay connected. I think that's some of the benefit that these programmes bring. I think one of the challenges for us in libraries is we're very good at keeping what we do a secret. So we're really keen to try and get the message out across the network, particularly with our partners in Leeds, about among our partners and our residents about what the breadth and depth of our library offer. So we've produced a series of short films, and we've produced one around health, which is should be on the next slide, Lisa. So the development of the Wellbeing Pods in 8 of our library sites across the city is one of the latest initiatives in this programme of support for health and wellbeing across our library network. Now, the concept for the initiative really came about from some multidisciplinary team meetings that we were having with partners from health and children and families and libraries when we were looking at a city level to develop a funding bid for family hubs. The proposal was to use the existing infrastructure of mainly one-to-one glass box meeting rooms, although some more traditional meeting rooms that we had available in our libraries to support well-being. So for context, our libraries in Leeds are located with customer services to form a network of community hubs and libraries. And our customer services colleagues had previously used these one-to-one meeting rooms for some of that confidential work that they need to do around benefits advice, for example. But following the pandemic, we identified that there was a little bit more capacity in terms of the utilisation of these rooms. So the suggestion was made that maybe we could look at reconfiguring these as informal spaces for health and wellbeing activity. But as with all new ideas or initiatives, really important, and the timing for this proposal coincided with a pressure within the health service around space, particularly within GP practices, where maternity services were being asked to find alternative accommodation. So the potential to use these library spaces for health activity was really welcomed by health partners, who not only saw the opportunity to relieve that pressure that maternity services were under, but also really excited about the wider potential of this initiative. So we were asked to provide costings for the transformation of what really were some quite sterile one-to-one meeting rooms into what we were now going to call wellbeing pods, with a focus on the needs of the maternity service providers in the first instance. So in Leeds, we have a contract for the fit out of our libraries with Opening the Book, who were given a brief to design and cost these new spaces for us. So joined now by Rachel Van Riel, Director of Opening the Book, who's going to talk us through the design principles. So over to you, Rachel.
Thanks, Andrea. You said the suggestion came up. I think it was your suggestion. You should take some credit. As a chief librarian, always looking to make connections and maximise the possibility of libraries, this was just such a fantastic opportunity. So we looked at the spaces and we looked at the needs, and there's some really key principles. We wanted it to feel friendly and not institutional. It isn't a medical context. It's got to be comfortable and relaxing, but it's also got to feel safe and private. And the mix of things, it had to be practical for the staff who you'll hear from later to do what they needed to do. But it had to fit quite a lot of stuff in because they needed stuff. And of course, on the library side, we wanted to put stuff in as well, because that's such a great opportunity to put some books in. So, somebody coming for an antenatal appointment sees there's free books, once you have your baby, just fantastic. And there was also, especially I think when we first started, because it was a new project, we needed to be able to flip them for other uses as well. Though I think actually it's working so well for health and well-being. I think they could be booked up for that entirely. But, it is still able to be used for other privacy. So that's just a visual of what we prepared to sort of talk it all through with all the relevant partners. Go on, next slide, if you would, Lisa. So the colour palette, I think this is really important. What happens in projects, it's not that people don't care about the colours, it's just they buy one thing from somewhere and one thing from somewhere else. Libraries are very good at this, and you end up with a sort of mishmash of there's a bit of this, there's a bit of that, nothing matches, and it doesn't look that coherent. So we said right from the beginning, to get this look, we need to do things that actually have a style to them. So the standard examination table there on the right, it's only available in certain colours, but if you pick the mauve, which is less institutional, you could then pick a rug. The floors had to be practical, but we could then pick a rug to make it match and make the whole thing look like it was, welcoming in a nice way. The fabrics had to be really practical on the seats, but you can see we've gone for quite a gold pattern there, which works in with the mauve. My colleagues in Opening the Book worked on all of this, and that's what helps to give the whole space a really nice feel. And you might think, well, it doesn't matter what colour the rug is, but actually it does. Thanks, Lisa. So then we had to get the resources in. And there were key things from the medical side, and Julie Holmes, who you'll hear from in a bit, was immensely helpful because we didn't know enough about that. We checked, she made suggestions, and then anything like even the trolleys where we were saying, oh, we don't want a horrible looking one, can we find a nice looking one? She checked, yep, that will work. And I think one of her major interventions, and Andrea, you'll support this, when we first looked at the spaces, we were concerned, having done lots of refurbs, that the issue would be running water. And how do you get running water to spaces that don't have it? That could have been the most expensive thing. And Julie said, well, no, there's these mobile sinks you can get that are all self-contained. So that's what we're using. So thank you for that. That just freed the spaces up and cut the budget, you know, back. It could have all gone on plumbing otherwise. So for those of you thinking of making similar initiatives, I think that's really, really important. But also you do need the practitioners who are going to use the space to tell you what they actually need, because otherwise you might equip a space and then it's useless to them because they can't do what they need in it. But you can also see on the right that as library people, we wanted to get some library resources in as well. So every single one of these pods has books in. So they have health books, obviously, but they can also have books which are just nice books to look at, relaxing books, books with lovely pictures in, books for toddlers, you know, it's a real nice mix. And actually the staff can change the books according to who's actually in there. And, you know, if there was going to be, for instance, you know, a young adult mental health session, you could put some YA books in there, you know, fantastic. And we put a leaflet holder because we didn't want stacks of leaflets and posters all stuck around the walls and stuck on the glass. You know how quickly spaces get cluttered and messy. But there are essential leaflets that a practitioner wants to reach around, just be able to say, take this home with you. So we put a leaflet board in as well. So you can see it's the mix of those things. I've split them on this slide, but actually in reality, you know, they're all together, which is a kind of symbol of what we're trying to do. Next slide. Privacy was really important. We knew that these fully glazed screens, they had kind of safety manifestations, you know, with dots on. We needed more than that. So we used the graphic design that Leeds had for Wellbeing, which is lovely. And the manifestation, there's not just across the middle safety bit, it's actually opaque all the way from the top to the bottom to give privacy. But we wanted to let light in. So for more casual things, that's enough. But if you're actually going to do an examination, people might feel quite exposed. So we also have on the left there a portable screen, the standard kind that you'll see in lots of medical contexts, which can be unfolded round the examination table to make the person feel that they are absolutely private for a more private examination. So I think privacy is really important here if you're wanting to do activities which require privacy. Thanks, Lisa. And the other thing is each space is individually designed. Here's the 8 of them. 6 of them on the left are the glass boxes that Andrea's already referred to, but they're not actually all uniform. They're different sizes. Some of them are glazed on one side, some of them on the other side. And the 2 on the right are actually office spaces that were quite different. And I think, again, it's really worthwhile looking at each space. They've all got similar things in, but they're not identical because you wasn't enough wall space. Where's the best space to put things? How do you give the privacy? How do you get people in and out and it just feels welcoming? They are really small spaces, as you'll see. You know, it's how do you maximize a very small space without making it feel completely cluttered? So each one we did give that attention to, and you can see them all there. So I think that's just a quick run through some of the design principles if you're looking to do something like this. And I think what it shows is the creativity of when you bring together the space available in the libraries and the people with the knowledge about how to use it, you're going to end up with such an exciting possibility of reaching people. The library can reach people they wouldn't normally. I think some others coming in from the more the side of the medical side are also going to have that chance. So for me, it's just been an absolutely wonderful, good use of space that was underused. And I think what we've shown is you don't need a lot of money. What you need is a lot of creativity and willing partners, you know, people who you'll hear from everybody next who are actually using them. But I think that was a jump to come and use a library space, and they deserve lots of congratulation for that bravery, and it's paying off. So thanks a lot for that. Back to you, Andrew.
Oh, I was on mic. I was on mute then. I don't often put myself on mute. Thank you, Rachel. That was really helpful. So we shared these proposals, design proposals for the pods, with partners, and everybody loved them, really loved the ideas that Rachel's just talked you through there, and identified funding from within CCG budgets to facilitate the repurposing of 8 interview rooms across the city, and therefore transforming them into wellbeing pods. Key to it obviously is establishing some, because we're working across partners and across services, so we wanted to make sure we had some governance in place. At the moment, it's quite loose. We have a steering group of the key partners across libraries and health teams, and we meet every 4 to 6 weeks. The meetings up to this point have quite largely been taken up with operational issues. That the challenge of setting services up from scratch is not to be underestimated, really. So the whole issue, all the operational issues associated with the bookings, and identifying the different partners who are going to go into them, and then aligning the bookings in the relevant locality as well. That took up quite a lot of time. But we've pretty much got a lot of that bedded in, and we're moving on now to have conversations in those steering group meetings around our approaches to evaluation, and where do we go to from here, from this early stage. And some of that's going to be picked up later, as I said. I think key to the project is that whilst the funding for the transformation has been made available from health budgets, the pods remain very much part of the wider libraries estate. So, the spaces still remain within the libraries estate. So this point is picked up in a draft MOU that we've been working on. Just got a few more tweaks to do to that. And as well as that point about, the ownership of the rooms, it covers other areas such as expectations for those who are both using the pods, as well as expectations of the library service in terms of providing those spaces. Communications and review and evaluation are all included in that MOU as well. So, as I say, one of the key things we've been looking at was the bookings. And I think one of the key things about the bookings is, being located in libraries, that actually opens up opportunities across the breadth of library opening hours. So these spaces are also available during the evenings and Saturdays as well, which has been an added value. So moving on to the next slide. As I said, the priority service identified for having access to these spaces in the first instance was the maternity health population, particularly because of those pressures that they were under around finding alternative accommodation outside of GP practices. So the priority was this population, and those partners that we're working with are our midwives, members of the perinatal team, and the smoking cessation, the maternity smoking cessation teams as well. Having accommodated, made sure that actually all the midwives or the other teams that needed access to them have been accommodated. We've been able to open up the rooms to other health practitioners as well, and we have now dietitians more recently using the spaces, and partners from Leeds Mental Wellbeing Service as well. Before any team starts to deliver from the pods, they're supported with an induction. This covers a visit to the site with basic information about the site itself that the practitioners will help them to familiarise themselves with the site. We introduce them to the staff on site. And as a crucial part of this meeting is providing information about that wider library offer, because we see this as a key piece of the jigsaw. Some of that wider offer has got the potential to have significant benefit to service users. So we see the benefits of this initiative going way beyond simply being around helping to relieve pressure in a GP practice. So next slide, please, Lisa. At the heart of this initiative is the fact that these wellbeing pods make use of that friendly, non-stigmatised environment of the local library, and therefore has the potential to reach a wide range of people, including many who may feel uncomfortable in a clinical space. And essentially, they really facilitate the delivery of a clinical service, and in this case, maternity services, which better benefit from that community-based service delivery model. So as we've been talking about, a focus on maternity population and really does allow us to demonstrate that connection with relevant library offers that support both maternal mental health and wellbeing, as well as early childhood development as well. So if we move on to the next slide, just to showcase this, that link to wider library offers, the relevant offers here that you might think about straight away, obviously, story and rhyme time, very much at the heart of our library programme of support for babies and preschool children. And we know that the benefits that these programmes bring in terms of supporting children's early speech, language and communication skills. But some evaluation undertaken by Shared Intelligence a few years ago also evidenced the importance of these sessions in terms of supporting maternal mental health and wellbeing. And obviously that's largely derived from the benefits of having a regular activity to attend, the chance to meet other parents and carers, and crucially that time to spend with your child, quality time to spend with your baby or your young child. Culture and creativity is another of the 4 universal library offers, and we're really looking to model a programme of creative activity in those library sites where we have the wellbeing pods. So these activities include our lovely play boxes, that's in the middle photograph there on the left. These incredible boxes were designed in partnership with Playful Anywhere and Playful Explore Art, to local organisations in Leeds. And these mini play boxes contain games and activities. And the brief for these was very much around a focus on speech language communication and numeracy as well. And the beauty of the boxes is, I mean, they're just such fun, colourful, playful resources. But the contents are very easily replicable at home. So very filled with everyday objects like measuring spoons, dustpan and brush, pegs, ping pong balls. And they come with some information for parents about how to engage the children with their children in accessing the resources. We've got some videos on our learning platform. We're just really hoping that these will stimulate ideas for things that parents can do with their children at home, but also the fact that we've got them in our libraries. We hope that they'll encourage people to come in, to stay a while, to linger, and to, you know, have some quality time with their children as a family. Something we've introduced into our libraries, mainly our central library initially, has been a baby photo booth, which is a chance for an affordable professional photograph of your baby in exchange for library membership and 2 visits. And we're just really using that as a hook to get new parents into the library, and something that, again, we're wanting to roll out to these wellbeing pods where we're linked in with maternity services. And again, something we trialled earlier at a workshop in Central Library, but again, looking to roll out to our wellbeing pod sites, is a pre-birth black and white bookmaking workshop. This session was a real chance for prospective new parents to create a high contrast book for their babies. And we know that high contrast images can really engage newborn babies while their eyesight is developing. So these sessions were very much a chance to meet other soon-to-be new parents, a chance to relax, to engage in a creativity and make something for your new baby. And it was also, of course, an opportunity to talk about the benefits of reading from the earliest age with your baby, and the benefits of reading in terms of bonding with babies as well. Probably doesn't seem quite as likely, but our digital support programme is really important in terms of this agenda. The 8 wellbeing pod sites are also going to be the sites of our digital health hubs in Leeds, our first digital health hubs in Leeds. But in Leeds, I'm sure I've got this right, Julie will correct me if I'm wrong, but our maternity services in Leeds are accessed via online self-referral. So for any women who have problems with accessing digital equipment to make those referrals, or they need support with skills, we can help with our tablet lending and also our skills session. So what I love is the fact that our service isn't a set of boxes, silos. All our different offers come together and merge, and it's interconnectivity of that offer, which I think is really vital. So that's a real quick run through of the Wellbeing Pods, the background to it, and the benefits from our library service point of view. What do those who are using the pods have to say? So I'm really pleased that we're now joined by Julie Holmes, who's our matron for community midwifery, Paula Garrigan, who's the clinical operational manager for perinatal mental health, and Ridley Desai, who's a dietitian with the PCN. So Julie, Paula and Riddy will each talk about their experiences from both the staff and the service user point of view. So firstly, over to Julie, I think.
Thank you, Alison. Yeah, so our background for our maternity service in Leeds is just a little bit background that our traditional model of care is through providing our services through GP practices. And just to give you a little bit of insight, that we work out of approximately 80 GP surgeries, 8 health centres and around 5 children's centres across the city. So we do take up a lot of clinical space in, especially in GP practices. As I mentioned at the beginning, obviously there's increasing pressures on primary care for their estates. Obviously a lot more services are asked of them to produce. So that does have a knock-on effect for maternity services, who are sometimes asked to vacate the clinical rooms that our midwives have used for so long. So around January 2022, we came together as a group, as Alison has mentioned, to look at the idea of these community hubs. And it was a really exciting project to work with and come to some solution. I mean, it won't solve everything, but obviously to help with some of the estate problems. And just there, I've listed obviously some of the partners that was involved in this project. The result was the launch of the 8 wellbeing hubs situated in the libraries across Leeds and used by multiple services. And what was really good was because they asked obviously us as maternity services, what areas are we really struggling in? And although we can't have hubs everywhere across the city, that would be excellent. It was really focused on asking us, where are we really needing it there and now? And is there a library that they could facilitate with them hubs in? So we felt it was quite bespoke for maternity services. So that was excellent. Thank you. Next slide, Lisa, please. So we obviously do speak to our service users and our staffs. We're just at the beginning of getting really clinics embedded, because it has taken a little bit of time. So the numbers we did the order on aren't big to start with, but we've started them. And again, these are the hubs that we're using across the city. So we're using Holt Park, Compton Library, St George's Centre in Middleton, Headingley and Hunslet. And there's just obviously a percentage of where the service users that we spoke to attend. How did they find the facilities there? So obviously we've got a big chunk of average, and we've got some outstanding there, which is great. How accessible to find the hub? So they're very accessible. And again, what we found, one of the benefits of the libraries and the hubs is that they're usually situated somewhere quite local, so a lot of the local people can get there, so they're quite accessible, walking distance or bus routes, etc. And then obviously we wanted to find out, well, for that service user, what does it mean? Do they want to come to the hub, or do they want to prefer to stay where they were surgery? And of course, it's more or less there 50-50, not much difference there. And I think a lot of that is because we've always been in GP surgeries for so long that a lot of our service users don't really know any different, and it's changed, isn't it? So hopefully as we go along and they're aware of what other fantastic services they are within that hub, we'll probably see it tick to more people wanting to go to the hub. Next, Lisa, please. So obviously I'll say so some feedback there from what we're getting from our service users. It's great to see that we're getting some feeling that the facilities there are really good at the hub, really easy to get to. less people there waiting, because what we do know for certain populations, certain areas, that they don't always want to go to a GP surgery, because if they're sat in a waiting room, for instance, with the midwife door, people know that they're pregnant, and some people don't want people to know they're pregnant so early on, and so that's quite good positive feedback there. Obviously going in there as well, it's so much nearer to the home and things like that, and so it's really good feedback that we're getting there. But obviously with that, we do get some people that feel that it's not as good as a GP surgery, so some feeling that the room's too small, and no windows in, feel that parking was an issue, because a lot of the libraries is excellent parking facilities, but there's certain ones where they do struggle around getting a car parking space, and that can be a problem for some. Next slide, please. And of course, what do our midwives think of the hubs? Again, it's a real change for them, because they're used to working in these clinical environments. So we wanted to find out what do they really think. But this has become really positive feedback from our staff, and that the library staff, I can't say this enough, I keep saying it at our meetings, that they're so welcoming of our staff, and that's really great to see, and hence really welcoming for the service users also. So midwives say they feel it's a real community feel, because they're coming in there, they're having opportunity to speak to them and showing them other services. It's really relaxed, rather sometimes with GPs, because it's GP surgeries are so busy, aren't they? So it feels a little bit more relaxed there. And I've just put this one on, that obviously it's promoting bringing, if they're having to bring the children with them, it's really good, because there's so many other services within the library, what they can be enrolled into, play groups, reading times, etc. And for a midwife, that's really nice for them to have that as part of their role, to feel that they are engaging them really now, even when they're pregnant, to what actually they can have once their baby arrives. So there has been some feedback from staff about, obviously, oh, it's a bit small and it's a bit hot in the middle of summer, but we've resolved them little teething things. We've put fans in there, the water jugs for our service users. So if these issues, we're dealing with them very quick, just little tweaks here and there. But overall, our staff are so happy to there and so happy to be welcome there. Thank you. Next slide. And just finally, I just thought of one of our midwives there, hard at working with the hubs, and you can see, although she's got her clinical role to do in the background, there's the books there that we can promote to our women. And as I say, we're not in the full 8 hubs as yet, but as a result, we've been able to free up space in 9 GP surgeries and health centres. So I know it only seems a drop in the ocean to the 80th plus that we use, but it's a real starting point. And I would like to take this opportunity to massive thank you for everyone involved, Andrea, team at the library, everyone, primary care, because I think they've welcomed maternity services into your area and made it feel like ours as well. And certainly I can speak probably for everyone at Leeds Teaching Hospitals and maternity services. We're so proud to be part of this project, and thank you.
That's great. Thank you, Julie. It's a real pleasure to be working with you. So now I'm going to hand over to Paula Garrigan from the Perinatal Mental Health Service. Paula.
Hi, afternoon, everybody. So my name is Paula Garrigan. I'm the Clinical Operations Manager for the Perinatal Mental Health Service. Next slide, please, Lisa. So we're a service that provides specialist support to women experiencing mental health difficulties during pregnancy and following a child's birth of up to 2 years. We work with key partners in the city and the wider Yorkshire and Humber network, just to name a few: maternity, 0 to 19 teams, and the Leeds Wellbeing Service. Once someone has been referred to the team, a full assessment of an individual's needs is completed. The outcome of this may be to spend some time with our service, work in partnership with other key services, or possibly refer for care external to us. Sometimes we may need to do all of the above. So we provide support from a multidisciplinary team, including psychiatrists, nurses, social workers, occupational therapists, psychologists, and CBT therapists. so a lot of staff. Next slide, please, Lisa. And within that, we offer a range of treatments and interventions. So we offer preconception counselling, special advice on risks and benefits of medication in pregnancy and breastfeeding. We offer nurse and nurse sessions, including baby massage and sensory play, mother-infant interventions, looking at attachment and communication, group work, peer support, partner support, young carer support, and psychological therapies such as CBT and family therapy. Next slide, please, Lisa. So as part of this, some of the long-term ambitions, a key ambition for perinatal services is to offer those interventions that I've just said on the previous slide to more women and families. So trying to reach, you know, a wider scale and reach those mums that would benefit from our service, but we're still not accessible to. And also part of our long-term ambition is to save lives ultimately. And it's important to mention the long-term outcome of supporting women with mental health in the perinatal period helps to improve a range of outcomes for infants as they grow up, and can read more about that on the Embrace report. Next slide, please. Some of the challenges with offering to more women and partners in the city. Next slide, please. In order to be able to achieve the ambition of increasing access and supporting and providing more therapy to more mums and support partners and families, we needed more clinicians to do this, venue space, somewhere that's citywide and somewhere that's accessible. Next slide, please, Lisa. Then, as if by magic, a relationship was born. Next slide, please. So I know it wasn't by magic, and there's a lot of hard work gone behind the scenes, and that's something I can't take credit for. So we were there sort of wanting rooms, and the library services were looking for services such as maternity and themselves to fill those rooms, which was really, certainly for our team, really great timing. So these were going to be in local libraries. They were citywide, and even better, they were accessible by public transport. Some even have car parks, and some have mini cafes. Next slide, please. So what our clinicians and service users say. So the pods that are heading the library, it's bright and welcoming. There are a good selection of books available. It's a good space for information giving, and by being in the library service, users can get information about a range of services from housing to benefits. And some of our service users said we really liked the pod, found it very comfortable, inviting. It was very bright and airy. Next slide, please. It provides an accessible community venue, reduces stigma of medical centres. And I kind of want to just add on that a little bit, that largely the wellbeing pods have been amazing in that overcoming barriers. You know, as our next comment says, many women experience mental health difficulties, can feel ashamed of needing support, or might struggle to enter traditional NHS services or maternity settings. And also it can provoke distress if they've had a traumatic maternity experience to then go back into an NHS venue, or like a lot of our clinics can be run from the Mount Hospital, which is just down the road from LGI, where a lot of people do give birth. So an opportunity to offer service closer to people's homes and in a less threatening community setting, it was just a great opportunity. There's a variety of locations. We are citywide. We're working in smaller MDTs to make sure we can respond to the needs of our communities. So the fact that we've got these accessible venues, they're accessible, you can bring your buggy, and it's all these little things. There's facilities, there's nappy changing, which not all of our mental health NHS clinic rooms are set up for, and they are multi-use rooms, so not always that welcoming and friendly. Well, not friendly, but friendly looking the environment, should I say. So, and again, some of the benefits of actually the other services that run out of the library that sort of my colleagues have just been talking about. Next slide, please. So just to sum up, this is just the start of this partnership. It's been great to work collaboratively and share ideas and how to best use these spaces. Having this shared space also helps with networking and co-working, especially within a time of increased use of remote platforms. So we get to see some of our colleagues from other organisations and work together. And more importantly, it helps us to be visible, being at the heart of the communities. Thank you.
It's fabulous. Thank you very much, Paula. And now I'd like to introduce Radhi Desai, who's a dietitian with the PCN. Over to you, Radhi.
Good afternoon, everyone. So my name is Radhi. I'm the gastro dietitian working in Woodsley and Holt Park PCN. So recently we have started this service working in the PCN with the 12 GP practices. So it's myself and my colleague who is a dietitian specialist in diabetes. So I'm very new to this role, just started in end of March. Not much to say, but I have more positives to say about this Wellbeing Pods from myself, my colleagues, and our patients. So I have been using a couple of Wellbeing Pods. Today I'm at Holt Park Library, and I also go to Headingley Library Pods. Very new setting for me because I've always been working in a very clinical settings, hospitals, and very clinical spaces. So I think I'm liking it. It's very refreshing in terms of like non-clinical areas, and also based and located within the library. So it's good networking with the staff and other people who are visiting the libraries. Next slide, please, Lisa. So for my from my end, the positives are because of setup in the library, therefore feeling very safe and surrounded by the staff rather than working in the isolation. Sometimes if it's even in the corner of the hospital, sometimes you feel really isolated compared to here. The people are accessible, and also for both libraries, my very positive experience, their staff is really lovely and warm and welcoming and very helpful in small things. For example, I really like to mention that last week when it was really hot, the library got ice creams for everyone. They really offered, and it's just really nice. It's just feels so nice and welcoming because I'm so new. So I really appreciate from the staff members. So as I said, still early days in my role, but I think everything is working well. And the clinics are now more populated compared to a few weeks ago. So now I'm getting busier. But before that, when I was just like very new, I had opportunity to use the libraries for myself, borrowing the books that is relevant to my profession and my area of expertise. And also I encourage my patients to use the library after they finish my appointment. So some of my patients say they have become a member, that they've been living in Leeds for many years, but now they are a member of libraries and started borrowing books and staying in the libraries and meeting new people. So which is really great. I think both of the pods have enough space for the professional who is providing the service and the patients, and sometimes when they come with the relative or carers. And I have started taking some feedback from the patients, and I think the next slide is telling about some feedback. Next slide, please. Thank you. So these are, I think, the general some challenges that sometimes some particular pods are when I think some people don't leave it very clean and as it should be. So that, and when you tell to the staff, they are really cooperative, and they just like, okay, no, let me give us 5 minutes and we'll make sure next time the pods are left clean and remain clean. So that is great. So I don't have much problem with that. And so yeah, this is also a teething problem initially when I was very new, so they didn't know me even though I visited them before I started. So if my clinic starts at 9 a.m. and the library opens at 9 a.m., sometimes I just like, it takes time for me to set up my laptop and stuff, and I'm a little bit running for my late for my first appointment. But that problems has been resolved, because now both library members, they know me very well, and 15 minutes before my clinic starts, they let me in and I'm all good. So no problem with that. As I think Julie mentioned about some feedback. So sometimes the rooms are a little bit smaller if patients or carers, they come with a wheelchair, and it's literally fit the wheelchair and the patients, myself. So sometimes, it's not often. So that's one problem I would like to mention. And also sometimes this closing, if my last patient's finishing like 4:45, and then library closes 5 o'clock, so this is a rush. But that is also, I've spoken with the PCN manager staff, so my appointment would not finish just like 4:45 or 5 o'clock. So that also been resolved. So there were a few problems when I started, but the talking and communication with other people, it is getting better and it's going smoothly. Next slide, please. So these couple of feedbacks from my colleague. One is health and well-being coach that I would like to read. So it works very well for appointments. I think no issues to report. Space is comfortable for patients and easy to access, and patients can wait comfortably in the library before their appointment. Staff at the library are kind and helpful. And this is my colleague dietitian. She says works out well, comfortable to see patients, and relaxing environment for the patient. Next slide, please. These are few feedback from my patients. So one of the patients says, I like here as does not feel clinical, as I do not like to go to the GP surgeries, as environment makes me anxious. Other patient says, I like to wait here before the appointment, and good to use library for some reading after the appointment. It's lovely here and easy to find, and parking, this Hall Park Library. Relaxing and calm environment for the appointments. So really good positive feedback. Next slide, please. I think that's all. Thank you very much, everyone.
That's lovely. Thank you very much. I think that's been really helpful insight into sort of some initial feedback from our service users, both the staff and the patients who've been coming in to use the pods. But we are looking to do a more in-depth piece of research and evaluation. So I'd now like to introduce our next speaker, Camilla Newcar, who's a lecturer in nutrition, physical activity and public health at the University of Leeds.
Thank you so much, Andrea, and thank you for inviting me here to talk about our proposed evaluation. I am doing this jointly with a colleague at the University of Leeds as well, who is a professor in applied healthcare. So hopefully will be a very useful collaboration for us as well. And when we heard about this initiative, we absolutely jumped at the opportunity to evaluate it. I will say that. So next slide, please, Lisa. Okay, so key aims of our evaluation. So just to point out that first, we are initially conducting this evaluation just focusing on the maternity care services. I know that the sort of idea is to expand the services, but initially we're going to focus on the evaluation of the maternity care. So before we start actually collecting data and so on, we wanted to do just a bit of a scoping review where we're exploring existing evidence on delivering healthcare in a non-clinical setting, so such as the Wellbeing Pods, although I don't envision that they exist in many places, but other sort of community-based healthcare. And then we want to capture some of the key some of the practitioners and users' perspectives of the pods. And we will do that using a mixed method approach. So we'll be collecting both qualitative data and quantitative data. So this will build on the audit data that has already been collected and presented today. And then the final aim is then to compare our findings to the existing evidence and make suggestions for future priorities, both for research and best practice. Okay, so next slide, please. Okay, so to give you a feel of the process of the evaluation, so you can see that outlined hopefully nicely and clear in the figure. So we are submitting the grant application here in July. The deadline is the 10th of July, so I'll be busy finalizing that. And then over the summer period, we're going to be doing the scoping review on the evidence on community-based healthcare. And then we'll be recruiting our participants in September. So we're going to try and aim to recruit a representative sample of all the pods. So as you've heard earlier, there are 8 pods in total. So this will be practitioners that are using the pods as well as the patient users of the pods. Okay, and then we will start our data collection, again, using that mixed method approach. So we will be collecting data using surveys. Then for the practitioners, we will be conducting interviews via Zoom, most likely. Just exploring their experiences using the pods. So that will include accessibility, demand, practicality. So these are all sort of domains that we collect data on when we do feasibility research. Then for the patient users, again, we will be administering a survey, just collecting some background information, and then also some brief questions on their experience in using the pods. That will be followed up with focus groups. So that will collect some more in-depth data on their experiences. Then following all this data collection, we will then proceed with our analysis. So that will be, again, a mixed method approach. So we'll have quantitative data as well as the qualitative data where we will be doing a sort of thematic analysis. And that will be followed up by the write-up and then the dissemination. So in terms of sample sizes, I saw a question earlier in the chat regarding sample size for the audit. For the purpose of the evaluation, when we're doing sort of interviews, usually in order to reach saturation of themes, then you need between 15 and 20 participants. In terms of focus groups, we'll be conducting several focus groups, trying to reach as many wellbeing pods as possible. These will be taking place, wellbeing pods in the libraries. They'll be taking place in the libraries around a sample size of 8 to 10 per focus groups. So again, you know, usually the bigger the sample size, the more generalizable the findings are and so on. So we will try and strive towards a big sample size. We will also, in order to reach this, give some incentives. So for the participants that complete interviews and focus groups, they will get a £20 thank you voucher. Okay, and then if you can go to the next slide, please. Oh, that is, yeah, next slide, please. So that is just to give you my contact information because my surname is very complex and everyone always gets it wrong. So if you want to ask me any questions in relation to the evaluation that we'll be doing, then feel free to drop me an email.
Lovely. Thank you very much, Camilla. That's really
You're
helpful.
welcome. I really hope that it will give you some good quality evaluation data to, you know, expand the use of the pods and so on.
Yeah, and for us to expand across Leeds, but also potentially across the national network as well. I think it'll be really helpful to have that that evidence. Thank you.
You're very welcome.
So moving on, just to let everybody know, we are actually, as well as this webinar, we are actually hosting an open day. If anybody is able to visit in the locality. We're having an open day on the 21st of July at Hunslet Library. That's one of our fairly newly refurbished libraries. It's an absolutely beautiful library, actually, an Art Deco library. And that obviously has one of our wellbeing pods located in it. So 21st of July, 10:30 to 1:30, fairly loose format, a bit of a drop-in, different activities going on. We'll share the details of that along with a recording of this webinar after the session. So as I say, people are welcome to drop into that. Camilla shared her contact details. I'm sharing here just two other my contact details and also Eloise's contact details from the health team, if you've got anything in the meantime. I have seen some questions coming through, which is great. What we're planning to do is do an FAQ that we will share again with the recording. So if you haven't had chance yet, if you'd like to use the chat function to put your questions in, then we'll collate those and share our responses out as part of an FAQ. But I think before I finish, I just think next slide, Lisa. I think we'd just like to thank a whole range of people. In addition to the people who've been speaking on the call today, there's a whole range of other partners who've been involved in this development, particularly in the health service. And I would like to give a particular shout out to Liz Wigley. Sometimes when these, to get real traction on these developments, you need somebody who's really going to champion it for you. And I would say that Liz, of everybody, I mean, and everybody played a part, but Liz of everybody was that person to really help us do what we needed to push it through and over the line. So, but thanks to everybody on this call or our partners in the background who've been working so hard to make this a success. And I'd also like to thank my colleague today, Lisa, who's done not only the groundwork in operating this webinar today for us, but also she's done so much work on really bedding in those early bookings, which has been no mean feat. There's quite a lot of detail in getting that all up and running. So thank you very much to Lisa. So I think that's pretty much all we'd like to say. Please continue to pop any questions you've got in the chat and we'll get back to you. And I think it just remains to say thank you very much for joining. Thank you.